Hi, my name is Madison Bergen. You have probably seen the show Hoarding Buried Alive on television or maybe heard the gruesome details about it from someone you know. When I was a younger girl, my dad and I lived next door to our family friend who had a bit of a hoarding problem. Whenever I would go over there, there was always tons of things stacked from ceiling to the ceiling and not much room to move around. I remember my mom and I would always try to go over there and help them get rid of things, but she would always sneak behind our back and pull them out of the trash to rehide them somewhere else. This was always very weird for me because I always came from a super tidy and clean house where everything has always had their place and everything was organized. According to the American Psychiatric Association's website, authored by Rana Parek and accessed on March 26th of 2021, hoarding disorder occurs in an estimated of 2 to 6% of the population and often leads to substantial distress and problems functioning. Some research shows hoarding disorders are even more common in males than in females. Today, we are going to be discussing hoarding disorders. To start, what exactly is hoarding? We are going to further discuss what it means to have this disorder, but first, here are a few examples to give you all an idea. Hoarding is an ongoing difficulty dealing with parting from items or possessions because they are believed to serve a purpose or have special meaning. People who hoard are usually taken over by the thought of having to get rid of their items. The second thing we're going to be covering today is the effects of hoarding. Hoarding can easily take over someone's life and how they interact with others and their own family. Here are just a few things that hoarding can affect on a day-to-day basis. Hoarding can increase the likelihood of family conflicts. It can also increase the feeling of depression and loneliness. This can also cause you to have a lack in your motivation, and this can also increase the likelihood of illnesses due to unsanitary conditions. The last thing we are going to be discussing today is this disorder treatable? A question you might all have is this disorder treatable? Some may say no, but the answer is actually yes. We will be discussing the effects and options available for treatment later on. So now that we have gotten the main idea of what hoarding actually is, how do you know if someone is on the verge of this disorder? Signs of hoarding disorder can be feeling the need to keep every little thing that is acquired throughout your lifetime. You might also notice certain parts of your home starting to become dirty or unreachable because of all the clutter and filth. This disorder or obsession with keeping items that are no longer of use of meaning can begin even in your teenage years. Hoarding can be classified into many different stages, but it often begins as clutter piles up here and there. This can get out of hand very quickly if it is not monitored or kept in control. In furthering my research, an article from the ADAA, which can better be recognized as the Anxiety and Depression Association of America, accessed on March 22nd of 2021, states that hoarding is a disorder that may be present on its own or as a symptom of another disorder. Now that we have gotten a better idea on what hoarding exactly is, let's now move on to how this can affect somebody and their family. This disorder can cause someone to feel very unmotivated or even super depressed. This especially does not help when you're already dealing with a dirty environment and dirty conditions. I don't know about you guys, but I always feel way better when my living space is very clean and organized. These living conditions can also prevent someone from keeping up with their personal hygiene. Oftentimes, people let their homes go after years of hoarding. Necessary spots in the house eventually become blocked off with clutter or unusable due to lack of upkeep. As I mentioned earlier, these unsanitary living conditions can also lead to serious illnesses if not monitored closely. I can tie this back to the story I mentioned earlier about my family friend. It is never easy to see someone you love and care about basically give up on themselves and their own home. They basically lose their life to hoarding. This can cause many arguments and disagreements between families. Ultimately, at the end of the day, your family and friends just want the best for you. Nobody wants to see their family struggling to keep themselves afloat. Since you now have a better idea of how this disorder can affect the hoarder and their family, let's now move on to how effective treatment can be for this disorder. Are interventions and therapy effective in treating hoarding disorders? Yes. These treatments are set in place for these types of people to try and fall out of their bad habits. Family and friends usually try to get the person of concern to start getting back into the habit of treating their bodies with respect, kindness, and care. People who have issues with this disorder almost always need the help of others to be able to pull themselves out of this and their bad habits completely. This treatment can also benefit the person with the hoarding disorders. These treatments can help benefit the person with the hoarding disorder by allowing them to create new healthy habits. Although these treatments might not be effective 100% of the time and the person can fall victim to a relapse, it always helps to try them out. Today, we got to take a deeper look into what a hoarding disorder truly is. We learned about what it means to have a hoarding disorder, how it affects the person with the disorder and their family, and how interventions and therapy can help treat this disorder. As I mentioned before, hoarding does occur in 2 to 6% of the population and is also more common in males than in females. Growing up, I did not really understand what was going on in my family and friends' home and why it was always so disorderly every time I visited. It was never really easy to see someone you care about fall victim to this disorder, but unfortunately, this does happen to a lot of people. This information I presented to you all today has truly helped me to better understand why my family friend is the way she is and how it affects her family and friends. I hope you all are now aware of how this disorder affects people and how effective treatment can be for this disorder.